بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Jars for ectopic pregnancy and gestational trophoblastic disease. Keep in mind that in any OSCE station, if you have a jar, you will be asked one of the following questions. Identify the specimen. Describe the pathology found. Give the clinical presentation of a patient having this pathology. How to diagnose it. Differential diagnosis of this pathology. Treatment options for patient having this pathology. Operation done for removal of this specimen, and many other questions related to the theoretical background of the pathology found. This slide demonstrates a case of tubal mole. Tubal mole is one of the varieties of disturbed ectopic pregnancy. Specimen shows a swollen fallopian tube removed by salpingectomy. The tube is opened to show a hematoma within the lumen. This is the full screen picture of the previous slide. This photo demonstrates a sectioned fallopian tube containing a tubal mole. The tube contains a gestational sac with an embryo inside, surrounded by blood clots. Chart demonstrates a case of incomplete tubal abortion. The specimen is removed by salpingectomy, showing a distended fallopian tube. The femoral end is dilated and the umbilical cord is passing through it and attached to a fetus of about 16 weeks gestational age. This is a full screen picture of the previous slide. It shows a distended fallopian tube, fetus passed through the femora, connected to it by an umbilical cord with a piece of omentum removed during salpingectomy. This jar represents another case of incomplete tubal abortion. The specimen is removed by salpingectomy, and the fallopian tube shows incomplete tubal abortion, but chronically disturbed. This is the full screen picture of the previous jar. The tube is swollen, showing a retort-shaped structure. Jar represents a case of tubal rupture, one of the varieties of disturbed ectopic pregnancy. The specimen is removed by salpingectomy. There is a distended fallopian tube surrounded by ecchymosis of the serous covering. There are gestational sac and blood clots protruding from the ruptured tube. This is a full screen picture of the previous jar. Notice that the tube is ruptured and the gestational sac containing an embryo surrounded by villous shaggy tissues. This jar represents a case of ectopic pregnancy in a rudimentary horn removed by hornectomy. This is a full screen picture of the previous jar. The rudimentary horn is sectioned and characterized by its thick myometrium surrounding the gestational sac. The baby is found outside the horn. The following slides demonstrate some jars for gestational trophoblastic disease. This jar demonstrates a case of complete vesicular mole. The specimen shows some vesicles threaded together and expelled from a case of complete mole during suction evacuation. This is the full screen picture of the previous jar. This jar demonstrates a case of invasive mole. Invasive mole is also called chorioadenoma disturbance. The uterus was bisected in coronal plane. Uterine cavity is normal, and the uterine wall is invaded by necrotic hemorrhagic mass. Perforation of the uterus is found. The specimen is removed by total abdominal hysterectomy and bilateral salpingio-oophorectomy. This is the full screen picture of the previous jar. Notice the site of uterine perforation just above the attached adnexia. This jar represents a case of choliocarcinoma. The uterus is removed by total hysterectomy. The uterus is bisected to show hemorrhagic mass filling the endometrial cavity. This is the full screen picture of the previous jar. Under microscopy, choliocarcinoma is seen as sheets of trophoblast swimming in pools of maternal blood. This is another case of choliocarcinoma. Specimen removed by total hysterectomy and bilateral salpingio-oophorectomy. The uterus is opened by coronal section, showing necrotic friable hemorrhagic mass in the fundus with infiltration of the myometrium. This is a full screen picture of the previous jar. This is another case of choliocarcinoma. The uterus is removed by panhysterectomy. Uterus is enlarged and longitudinally bisected. The uterine wall is the seat of a hemorrhagic necrotic mass. The cervix is also a seat of another metastatic necrotic mass. There is free area between the two masses. This is a full screen picture of the previous jar. Thank you for your attention. All good wishes and goodbye.